Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Dr. Amore comes in along with Rick Pepe, but we have to stick to one. We were laughing because there are a lot of things we could talk about. I said, well, as a chiropractor, you've seen it all, and now in anti-aging, you really have seen it all, and it all leads to a lot of sexual discoveries too, because all the important things that you're doing, Dr. Amore, people really do want to be the best they can be, and if they have no pain, they may also have some sexual dysfunction. And so I know that maybe in one of our next programs we can really go to it in depth. But I was doing some research, and we talk about stem cells, and I was not aware that stem cells were around in a long, long time. And you did some, and you were telling me about it.
Yes, they've been around since 1913. And in 1913, a gentleman created stem cells for an individual, a young lady that had some problems regarding regenerating, I believe it was tissue of, I think it was a uterine type of tissue that they were trying to regenerate, and they did that. And that was back in 1913. So, here we are, 2019, and it's, what happened from 2013 from 1913 to 2019, there's been a big surge of regenerative medicine again. I think what happens a lot of times is when the FDA or the other people get involved, they want to keep things to the side because they're doing well with medicine and medications. Why would they want to bring something into the arena that maybe starts to help you? Because now it's going to take away from the medical companies, pharmaceuticals, and they're not going to make the money that they were making. So I find that sad in one way, but it's good now that things are starting to come out, more and more, and you're starting to see more people looking into a different type of treatment for themselves instead of the standard care of surgeries or medication or whatever else they're going to be doing.
Well, we have people on Facebook, and I'm always interested in what really they want us to talk about. I thought the stem cells, it's a perfect discussion because we see it now. As you said, it wasn't so popular. I mean, it was popular if you were of that ilk, but today people really want it. They don't want the medication. I mean, we even heard in the debates last night what's happened with all the drugs. We've got to get rid of that, and we've got to go more to the natural that you do.
Right.
And I've heard all the shows you've been doing, and that seems like you really profess, let's get it done naturally.
Right.
That's and as a chiropractor, that's what I have found chiropractors to be. You've always wanted natural over the years, and of course, for years ago, chiropractors had a real fight on their hands to even be allowed to be in the medical world, right?
Sure, yeah.
But
sure.
you were smart, and you had a good, kind way of doing things, and now you are well thought of, and now you've been branching out. Mm-hmm. And I was interested, Rick, because you're very much into education. We were talking about all the shows that we have heard of before. What do you think about what's going on now with I would call it re-education of the public, wanting to have stem cells, PRP, anything that will enhance them without having to go through all that stupid medicine?
Correct, but that's been one of the biggest issues. A lot of people still go back to the doctors and looking for a resolution with the doctor. What we do at the office, we want people to feel better, quality of life. I mean, that's the biggest issue. A lot of people, we spoke to somebody a couple days ago, he had Parkinson's disease, okay? So Robert asked the gentleman, how you doing? How's the traditional way working for you? And he shook his head, no, it wasn't doing very well for him. So he said, ever think about maybe doing some stem cell treatments? And the first thing that came out of his mouth was, they're too expensive. That was the first thing that came out of his mouth.
Well, how does he know, though?
He researched it before. So his answer was not to, this could help me, this could save my life maybe. No, it was, again, had to do with money. You know, sometimes in life, you know, you can't put a price on how you feel, okay? You know, yes, insurance companies do help you a little bit in surgeries and things like that. That should be the last resort. You should always do some traditional medicine prior to doing any surgeries. The new techniques now with the stem cells, they work fabulous. I mean, a lot of people that we've already done, they're doing great. You know, the first thing they notice within a month is basically no pain. That's the biggest thing. Getting rid of the pain is the first thing that most people want to get rid of, and that's usually the first sign. Then from that point, we have a lady I spoke to yesterday, Alicia. She's listening. She actually her knee was tremendous. She could barely walk. She had a cane. So it took her about 3 months for her to actually do this procedure. So yesterday I reached out to her. She's doing great. She's walking much better. She has no existing pain whatsoever, which is awesome. I mean, you like to hear, you know, people with good results. I mean, that makes us feel that we're doing what we need to do to make them feel better.
You know, Rick, what I've often said when people have, if people can't really afford it, I've said, ask your kids. Ask your family, because they probably would contribute to help you do that. It's just they're embarrassed, they don't want to do it. But I think the worst thing is when someone does have the money and they say they can't afford it. That is really stupid. They'll go on a cruise, they'll buy a new car,
Correct.
But they don't understand. So how bad do they have to get before they'll try anything? They'll go to medication, right? And just stay in
Just stay in that state because that's the state they're comfortable in being in. And that's not the quality of life you want to have, relying on drugs, and they're just putting Band-Aids on every little thing. We're here to correct it. We're here to get you in the office, correct the problem. We don't want you as a patient any longer. We want you to move on with your life. Yeah.
Do you have payment plans?
Yes, we do.
Oh, so okay. And there's also this care credit. There's
Benefits
a lot of
is
stuff.
one of the best things that we offer. You know, the benefits is one of the biggest things that we offer at the clinic, which is no credit check. It's much easier for the patient.
But there's credit cards. There's lots of different things you can do. If you really want to have a quality of life, then you shouldn't even hesitate. You know, and I think the biggest problem that I find is that people are so set on insurance for all these years. They're used to having insurance pay, and so whenever they have to pay out of their pocket, they don't really want to reach in their pocket to pay.
But Dr. Amore, and I just want to introduce everyone. This is Dr. Robert Amore. I know who he is, and this is Rick Pepe, who is the education guru there at the Amore Anti-Aging Clinic. I just want to say that as a chiropractor, though, you didn't have insurance. Most people came to you, and it was not insured.
Back in the day, they didn't have insurance for chiropractic treatments, so they had to come and pay cash, or they had to, And I knew some doctors that would put a hat in their office and say, "Listen, pay what you can, put it in the hat, and we'll treat you because we believe that we can make get you better." And he did very well actually. The Dr. Pastursky up in Margate, Florida, and he did very well. But there's lots of doctors like that all over. We have to do that.
Well, I think what we should do is forget that right now. I want people to be chomping at the bit and salivating about getting better. And something when I walked in, you talked about, and you gave me this article, which I think we ought to talk about. We don't have to talk too much, but where it says common joint pain treatment may be more harmful than thought. Why don't you expand on that?
So here's the biggest thing that just came out, I think it was yesterday or day before, whatever, regarding just regular joint pain or pains that you've had and the treatments that they've used in the past, like cortisone injections. They're finding out that doesn't work anymore. Well, why are you giving cortisone injections to pain in the joint? Why are you doing those type of treatments? They actually destroy the joint, destroy the tissue, and they don't help you in any way. Why don't you do, and don't give medications, why don't you do a little bit of physical therapy, get the person to exercise, lose weight, do things that are more proactive for that patient to get better than to give things that are negative going into the body that are just going to harm him down the line. And then that patient's going to be set up to take medications because they're not going to be better. And this is how the pharmaceutical companies win, because they set you up like that.
So what is cortisone, actually?
Cortisone is a drug that is a kind of a alleviates pain in your body. And
But where does it come from? It goes into the spine.
it goes into the joint system, or wherever you're injecting. Mainly, like orthopedics will inject it to the shoulder joints, knee joints, whatever, and it'll soothe that area. It'll go ahead and create some fluid in there and pain relieving, but it also destroys tissue. So the cortisone medication will go ahead and break up scar tissue, but it also breaks up bone tissue. So the hyaline cartilage of the joint will get destroyed. So now you have bone on bone in years to come. So that's why that's not a great little medication to give.
So that's why everyone who's listening, really, you need to think about this very strongly. Why don't you go and meet with Rick and meet with Dr. Amore and ask them, tell them what your problems are, let them examine you and see, and they'll offer, I'm sure, a better relief system than you're going to now, because just hearing what Dr. Amore said about this, that's ridiculous. We don't want that. And thinking about it also, it's expensive, and they're going to have to pay for that also. I have to assume if they come to you, this is not. Is there insurance on that?
On what, on the injections?
Yes.
Or, if we did PRP or whatever we do, but there's some things have insurance that we can do and some things don't. Medicare, we can do some things with, not as much, not with stem cells, but certain things we can
examinations
yes.
And
stuff like that, we can get them through with that.
Then you would
so
know.
They wouldn't have to put out as much money. But yeah.
But what we want to do now is really talk about the advantages of stem cell. And I know, Rick, you were just explaining a lot of the people who have been there and what's happened to them. So maybe what we need to do is to find out why they felt it was valuable enough to pay and why other people don't. So, we've talked about having someone on the radio show to
Correct.
talk about this.
We're working on that as we speak now. Again, a lot of people, when they do this type of procedure, there's no downtime. And that's the beauty of it. Okay, they walk in, they're walking out. Okay?
That's amazing to me.
When you do surgery, you're going to be laid up for, either shoulder surgery, knee surgery, hip surgery. You're going to be laid up for anywhere between 3 to 6 months at least. Okay? And again, we did a police officer in Miami for her shoulder. Okay? She did not want to be laid up. She didn't want to be behind a desk. So she did the stem cell procedure, and she's doing great. She has no more pain in her shoulder.
Isn't that amazing?
That's great.
So she's starting to see the results that she wanted to see, that we told her which she would see eventually. So that's the biggest thing, is telling people that this does work. There is plenty of research out there that this does work. Surgeries, yes. I mean, listen, that should be your last resort at the end of the day. Once you have surgery, there's nothing we can do to help you. We can help you prior to that, okay? We can redo, we can help to create new tissue, your own tissue in your system to help your body produce its own resources to help correct the issue. Not taking an appliance and putting it in your body that might not work.
I just want to correct you on one thing. With the surgery, he means appliances put into if you had surgery, say you had meniscus tear, and they did surgery on that, and it didn't work out, we can still do something with that because no
Correct.
appliance put in. But once you put an appliance in, then you can't do a stem cell.
I can't tell you how many orthopedic surgeons I've spoken to who are doing revisions.
Yes.
Now, if people don't understand what that is, you already went through the hip or knee surgery, but something happened and it didn't work. They have to go back in, and it's much harder that time to do it. Mm-hmm. So wouldn't it make a lot more sense for someone to do something that's smart?
Yes.
Absolutely.
This is the smart stuff.
It makes more sense to be more conservative initially. Before you even jump down that surgical implant type of situation, try the stem cell, try the PRP, try something that makes more sense, get you better, get you on your feet. Not having a possible infection, which is the worst thing to have.
Non-invasive.
The infection is a terrible thing. You're talking about that.
Yeah, you don't want to have infection. If you have an infection, you're laid up even longer.
Yeah.
And then they have to get rid of that infection. Say that infection doesn't go away so easily. Say it creates another problem.
That's right.
So,
Well, Dr. Robert Amore is certainly one smart guy, and he's very nice. I mean, I know you can see him on Facebook, and of course you can see his patient in crime here. Were you ever? Did you ever have any stem cell? Did you ever need anything like that?
I
Rick?
actually most likely have right now my knee is not on the up and up, so we're probably.
But do you have pain in your knee?
I do. Yep.
And what did that come from?
It
Uh-oh.
probably
Is it
came
something
from
bad?
my wife's listening, so I'm
Oh.
pretty sure she's laughing right now too. So it's from lifting over a period of time. So as we get older, unfortunately the joints take a hit and they start to wear down. So I'm at that point where I'm not doing surgery.
Yeah.
I'm either going to do the PRP or I'm going to do the stem cell.
Okay, and I thought about people who have plastic surgery. A lot of people, to make themselves look better, they know there's never been insurance on anything.
Right.
Grow more hair,
Right.
nothing, right? And I want to go back to the growing more hair because I know that's something you do. So you also, what do you do to make people look better too with the stem cells or the PRP? I've seen that.
Yeah, I mean, you have the facial rejuvenation. That's another one.
Well, tell me about that.
So the facial rejuvenation, which they have called the vampire look or whatever, but facial rejuvenation, normally if you go to your plastic surgeon or your dermatologist, they utilize Botox for the forehead to get the wrinkles out because they numb that area, so now the wrinkles aren't there. You kind of like that. and then
that surprise
right,
look all the time.
Yeah.
Yeah.
And then they do Restylane or Juvederm, lower areas, and these are medications that they use that they've used for years, and they last maybe 3 months, and then you have to go back again. So it's a temporary fix, and then people have these parties with Botox parties and this and that. So they're all temporary fixes, and they cost who knows what, $200 or more, an injection. So what we're trying to suggest to people is, wait a minute, why don't you try something that's going to help your body start growing collagen and elastin again back into your body? So by doing a stem cell or doing a PRP injection, and we can take the PRP injection and we warm it up, and we can make it a little like thicker, and that's like a filler. So we can use that as fillers.
Where is it? You actually inject in the face.
And you roll it in. It's a filler, and it stays in there and starts producing collagen elastin fibers. It starts growing new tissue in there. It starts filling out your face. It starts when you do it up in the forehead, you're starting to again get collagen there. Why you have lines is you're losing as you get older. You start to lose the tissue. It gets thinned out, and you start seeing lines more.
So do you feel it? Does it feel uncomfortable?
Not
How
at
does
all.
it feel?
Actually, it feels like if you went to the beach and had a sunburn on your face. That's what it feels like.
No, but then after that, what does it feel like after? Does it feel like all of a sudden you have a puffy face? Or?
No. Actually, in 24 hours, you're about 24 hours out of the water. You don't do anything in water for 24 hours. We put a little cream on your face at night, and the next day,
you don't even know it's been done.
No,
it's just
Most
there,
of the
right?
redness is gone.
The redness is gone within 24 hours, and then you're basically back to doing your stuff. So
that's pretty exciting stuff, isn't it?
It's not so bad to do.
Well, I think that's why when we look at your advertising, it's exciting because you talk about it being regenerative, and that's a big word. It's like regenerative medicine. What does that mean to you?
Well, regenerative medicine to me means that you're now creating from old to new, or you bring it back to newer. So if you're at like my age in the 60s, and you want to start looking, or you want your body to start feeling younger again and looking younger again, regenerative medicine would be your thing you want to do.
Why are you talking about the 60s? What about the 70s and the 80s?
In the 70s and 80s, I'm just saying my age was 60s. So in the 70s or 80s, it would be great things. Or 90s, my mom's 93. So different things you could do.
Yeah.
There's so many things you can utilize this for, whether it be neuropathies.
Well, let's talk about that. We never discussed that. What people have neuropathies.
People have neuropathy a lot, right?
Especially if they've had a cancer treatments. That's the first thing that happens.
Or they're diabetic.
Right. So talk about. We haven't discussed this.
So we can utilize again stem cell or PRP for neuropathy. So people have difficulty walking. Their feet get they can't feel their feet. What happens in the neuropathy? Blood flow changes. Nerve gets demyelinated. And the tissue under your feet, say in your feet, we'll do neuropathy for your feet, thins out. And so now you have a difficulty walking, you might fall more, So these are things that we can do and help people with instead of having, what do they put on, diabetic shoes, They don't really do much for neuropathy, really. That's the way it is. Rub some cream on there, and that's it. So, I mean...
So where will you, if someone comes in with neuropathy, where would you then do the PRP, your injections?
If it's a neuropathy in the feet, I would go for the feet. If it's neuropathy somewhere else, I'd do more a wellness shot and inject into the body. And
if you, let's say they have neuropathy, you put it in one foot rather than, which foot do you put it in?
Both feet if you have to. Both feet. If both feet are bad, but you want to, it's not going to stop them from moving. See, that's the greatest thing about this. You inject, you walk, either they can go right out and walk away. The thing is, let it start doing its thing. It's going to start growing tissue, start filling it in again, start taking the pressure. What happens, you have pressure on the nerve, blood supply has not worked so well down there, and so that's why you have this neuropathy. So this is why wouldn't you try this? Why wouldn't you try to stimulate growth factors, get things growing again, and replanting that seed, so to speak, and that new matrix in there, and then your body starts functioning better. It's a wonderful thing.
It is. So, Rick, you, as we were talking about, you've been listening to a lot of radio talk show hosts over the years. This is something very new. They never talked about this.
All the years I've been listening to radio?
No, I think I've only started hearing about stem cells maybe 3 years ago, here, locally. Mm-hmm. And then it was a little tricky.
Correct.
I knew someone who was part of a huge orthopedic group, and he decided he was going to do this. But most of his work had to be out of the country.
Correct.
And why is that?
Because, unfortunately, back then, it was not a legal thing to do. It was illegal in this country. So, as time has progressed, now they're recognizing it for helping with joint issues. There's a law, the 360 law, that basically you only can treat joints with stem cells. That's the law they have in place as of today.
Compared to treating what?
Compared to not treating anything before without
joints. So it has to either be, a hip, a knee,
Correct.
A shoulder.
Any type of joint.
Isn't that strange? What?
Correct.
That's so strange. Would you explain that to me, Dr. Amore?
Well, they don't want to. It's funny how they clear things. The FDA, it's all about FDA and what they believe it should be out on the market. Again, they don't want you to start doing stem cells for heart problems, for kidney problems, for diabetic pancreas problems.
Why is that?
Well, God forbid they lose money on all the drugs.
So you really believe this is all?
It's a big conspiracy.
Is it really?
It's a big drug thing. I mean, they're making billions of dollars a day.
Look in Europe. I mean, they already cloned animals with stem cells.
Oh, no, talk about that. I don't even know that.
They have. They've been cloning animals in Europe for a period of time with stem cells. They're creating organs with stem cells. They're not doing it here.
Well, they have done in a place called Human Genome Sciences out in California. They have they're not cloned, but they have created skin. You probably
for burn patients,
which is kind of cool. And they've grown ear, on a mouse's back. If you ever seen that picture, so they've done stuff, but they're working at it, But again, you're dealing with government and whatever reasons why they don't want things out there. Is there whatever reasoning? But I think that it's a wonderful possibilities they're setting up for people to get better. Why wouldn't you want to get people better?
So if people come into where you are, you don't have guards from the government watching what you're doing.
But probably after the show we're going to have some guards. I don't know.
No, but I mean, you are free. You are free.
I know, Obama.
I mean, you are free to do what you've been doing, the stem cell, because that's all approved where you are now doing it. Like we talked about where the stem cells are coming from and how you do this, right?
Correct.
Yes.
So they're not after you for doing this.
No, as long as we
stay
submit,
within the guidelines.
Yeah, I stay in the guidelines. I submit all my information to a company, and they submit it to the government, and they're creating a database of all the stem cells that are being done and what's being done for, and so creating all this. So we're trying, doing the parameters we need to do for the government and what they.
Well, I must say, when you mentioned Parkinson's disease, I was wondering if what's his name, Fox?
Michael J. Fox.
Michael. Yeah. I was wondering because he's doing so well. I wonder if he's been having that and he doesn't talk about it.
Well, I know he did a while ago. I haven't. You know,
Oh, did he?
Yeah,
He
when
did do it.
When he first had the Parkinson's, that was one of the things he had done. That was what? How many years ago?
And look how well he's doing
He's
today.
Still, yeah.
I mean, I was sure he was going down the tubes when he first got
Usually,
it.
when you get Parkinson's at a young age like that, it's usually very aggressive.
Yeah.
Right.
People that usually get it later on in life, it's usually less invasive. It's usually a gradual deterioration over time. But young people that get MS, Parkinson's, it's usually very fast. Lupus, same thing, very fast progressing.
Okay, so let's say that someone has Parkinson's now, and you said they come in, and let's forget the money part. Let's just figure out someone had Parkinson's, they're shaking their hands or their legs, and how do you go about this, Dr. Amoré? What do you do?
Well, in that situation, here we go. Again, someone who has Parkinson's, you naturally get a history. The same thing I do with every patient. We need to have a history. How long have you had the Parkinson's? But again, this is something that we have to deal with a little differently than doing a joint injection, because it's not a joint injection. It's in your system. So it's in your brain. These are things that we would probably do like a wellness shot, to get into the body.
Wellness shot.
So we stimulate.
What is that?
They have a shot. It's actually 4 injections into the body of stem cells. And we
Really?
send that throughout the whole body, and it starts to work on all the different problems that are going on.
And have you had some Parkinsonians?
No.
Have you
I
ever
haven't
had
any
anybody
Parkinson's,
that's...
but I know people have had done. I know.
So you have. So there is a history of this.
Yeah, there's a history of it. They're coming out with an IV one that you can go ahead and inject into the vein and inject it into the body, and it'll do a drip, and it'll do that for Parkinson's or any other wellness shot. They call it a wellness shot because they can't label it. We're helping we can't label it that.
Correct.
Okay, and I know we're just running out of time, but I also wanted to talk about diabetes too, and we haven't really covered those two issues. Mm-hmm. But I think a lot of our listeners probably have those: Parkinson's, diabetes, neuropathy. This is really why they may need to come to you, and I think we have to forget the insurance part, because if they come and they're truly in pain, we're going to figure out how they can get help.
Right.
Whether you do this on a payment plan or you do this with a credit card.
Right.
Please, everybody, if you're listening and you have a problem, don't let it go, because it will cause a lot of other problems in your body. Mentally, stress goes to your heart. So I'm so happy that Dr. Amoré and Pepe come on, Rick comes on, because they come on because I haven't really had a show that's gone in through all this, and I really like this. This is who I am and what I do. So thank you both so much for being here to help people.
No, thank you. Appreciate your time.